The regulations on risk management basically start in the MDR's Annex 1, which is about essential safety and performance requirements. This annex sets a standard for thinking about any risk that could potentially be connected to your device and for coming up with measures to control and reduce these risks. Now, let's see what MDR Annex 1 tells us. Chapter 1 starts with some general requirements that are at the core of what should be a medical device developer's safety mindset. It states that any medical device should be safe and effective, must not compromise the clinical condition, health or safety of your patients or users, and always provide high levels of protection. Article 2 explicitly states that the device must do so without negatively affecting the benefit-risk ratio. So that more or less says that the way you increase the safety of the device should not be such that the benefit of using your device gets diminished further than the risks. As an example, you could make your new surgical scalpel perfectly safe by making it blunt and made out of rubber. It would be very safe, but then the benefit of your device for operating on a patient would be zero. Article 3 explains how your risk management system should be set up. First of all, you must make a risk management plan that describes your risk management system. Next, you should perform a full analysis to inventory all risks of your device throughout its entire life cycle and assess and estimate these risks. You don't have to develop your own approach for that, because how this risk analysis and assessment should be shaped is extensively described in ISO standard 14971. And to help you even more, there's a practical guidance document ISO TR 24971, which explains all the terms, concepts, and approaches that you need so you can follow ISO 14971. We will extensively treat these later. After having listed all risks and their estimated severity, it's time to think about how to reduce and control those risks. That is to be done primarily during the design phase of your device. For that, Articles 4 to 8 give some guidelines. Risk control continues after the device is put on the market. That's because you have to set up a post-market surveillance plan. Post-market surveillance means that you have a system in place for registering and dealing with any adverse events or failures that occur with your device, like a hotline that people can call when your device breaks or causes danger in any other way when used. If you get one or several calls about a similar failure in your device or things going wrong because apparently users don't understand your device interface, you must try to find a solution to make this better. Already during the development of your device, Chapter 2 helps you with designing your device itself as safe as possible. But risks and control measures are not only about the device itself. No, it's also about the information supplied with the device, such as user manuals, repair manuals, interfaces, and even the labels on the packaging box around your device. For helping you do so, there are the risk management ISO standards we discussed that give you some guidelines on how to control and reduce risks, but there are also many more ISO standards for very specific aspects, like ISO 60601 for electrical safety of medical devices, which tells how electric systems of medical devices should be designed, made, and tested in order to be safe. Another example is ISO 20417 about the way you should provide information in a user manual, in an interface or on a package label with your device in a way that everyone understands it. And did you ever wonder how it's possible that so many symbols in user manuals, on devices, and even on the packaging of devices are so much alike? Well, we have ISO 15233 to thank for that. Because that's not just a document full of text, but it comes with an online database with bitmap and vector images of almost any symbol that could be used on a medical device. This is a great set of images to use for your medical device hardware or software interfaces, because these symbols have been tested with all kinds of users and are standardized. That way you can be rather sure that if you use one of those symbols, they will transfer the correct message. Sounds quite a bit better than each city having its own traffic light system and you being used to green meaning go, right?